My name is Chris Robinson with the Office of Recruitment here at the University of Arkansas at Pine Bluff. I know a lot of you guys out there in the audience. If you don't know me, you know me now, okay? But first of all, I just want to say, I guess, kudos to you for coming out here tonight. Some came voluntarily, some were forced, or given some incentive to come, but more importantly, you're here. And one thing about the University of Arkansas at Pine Bluff is that we want to provide opportunities for you if you want that opportunity for yourself. Everyone here is interested in some career, in some form of fashion that's in the health industry. And one thing we want to do at the University of Arkansas at Pine Bluff is give you as much exposure into that field as possible for whatever your chosen career is. So I'm not going to take a lot of time. I've been given the task of doing the welcome tonight, and I'm so excited seeing a good crowd out here tonight. But you have a very good speakers here, a wealth of knowledge. So please take advantage of this opportunity and ask those questions, get your questions answered. Take advantage of this knowledge that you have here this evening, and again, give you the opportunity to bring you closer to the career that you desire for yourself. Okay? At the end of the program, there will be refreshments served that's been provided by the Office of Development and the Office of Recruitment. I want to make sure you're properly nourished as well, since you're in the health industry. But without any further ado, I want to bring up a young man. He's going to talk about our speaker tonight. And again, I want you to listen closely to some of the accomplishments that this young lady has achieved. Would you guys please help me and bring it up, Mr. Wimmer?
Mr. Robinson, you know, I see so many faces of students that I've had a part in recruiting. And I tell my students, and I tell my colleagues, Dr. Butler, every single day, that I'm so proud to be a part of the University of Arkansas and Pine Bluff family. And tonight is another prime example of why I'm so excited to be a part of this UAPB family. But I have the task of introducing our main speaker for this evening. I've known about her for a very long time. She grew up just a block or two from the campus. Dr. Virginia Kane, she's the Associate Professor of Medicine at Indiana University. She's also past president of the American Public Health Association, which has a membership of about 50,000 people. She has served on the admissions committee at Johns Hopkins University and at Indiana University. She's also director of the Department of Health in Indianapolis, Indiana. In her list, she could probably fill up this whole wall. She's an outstanding person. Without further ado, I'm going to let Dr. Kane come up and tell you about herself, some more things about herself, and I'm sure you're enjoying Dr. Kane.
Thank you. Well, thank you. I'm primarily going to be the moderator, I think, tonight. And so hopefully what we're going to have happen out of this evening is that you'll get a better feel of what are the challenges you may face as you go toward a career, hopefully in medicine, or it may be in research, or it may be in public health. And what type of skill sets will you need to know in order to be successful in your aspirations. And we have an exciting panel here that will tell you a little bit about their story and their life and how they came to be where they are. And along the way, along this process, we're hoping that we may incentivize you, or I can get a slight feel for where you are in your knowledge base in terms of your preparation in your field. So we have $100 that we're going to give away tonight. And based on how smart you are for some of the questions that we're going to bring for you, for some of you maybe a little lunch money or some little travel money, but we'll just see how smart you are in the process. So, and we'll add these little questions as we go along. Let me just first introduce our panel. members, and I'm gonna, after I introduce the panel members, I'm gonna ask them one by one to just give you a little 5-minute little synopsis or background about them and where they are in the sciences or biological field or the medical field. So I'll start out with Miss Nana Aisha Adamu, who is a 4th-year medical student, I believe, at the University of Arkansas Medical School. And I'm going to go right after her and introduce you to, she's well known to everyone, anyone who's trying to be in the medical field here at the UAPB campus, and that's Dr. Buckner, who is chairman of the biology department, which is a department very dear to my heart because I believe my father was the former chair of the biology department. And lastly, Dr. Martha Flowers, who is the leading physician at the Flowers Family Practice Center here located in Pine Bluff. So I'm going to start out with Nana. Just tell us a little bit, 5 minutes about yourself. Where are you from, you know, what your major is, and, you know, what area of medicine you might be in.
Can you guys hear me? Like you said, I'm Nana Aisha Adamu. I'm currently a 4th-year medical student at UAMS. I'm originally from Pine Bluff. I went to Watson Chapel, graduated in 2006. After that, I attended Xavier University of Louisiana, which is in New Orleans, from 2006 to 2010. Subsequently, the year after, from 2010 to 2011, I actually attended a master's program at IUPUI, the same university that she's at, actually, and she actually taught me while I was there. I was there for 1 year, did a master's in medical science, didn't really complete it because I got into UAMS that same year, so I said, hey, peace, I'll see y'all later. That's not what I came for. I came from, you know, getting a med school, so I'm here now. Wanted to go into OB-GYN, interviewing right now, trying to get my residencies together, and in March, go through the match and hopefully match into a good OB-GYN program and hopefully come back to Arkansas and practice as long as my parents and my family are still around.
Thank you. And we'll open it up soon for any questions. And so you will have the advantage of actually just standing up and asking your questions, or we also have index cards that if you prefer to write your questions on an index card, you can do that as well. We didn't pass this out yet, have we? Index card. So let me just, while you're talking, Dr. Brown.
Good evening. Pretty much everyone knows who I am. I've been here at the university for this is my 6th year actually. On January 4th, I hit 6 years. I graduated from UAPB many years ago in biology. I have a minor in chemistry. I went on to grad school at Purdue University in West Lafayette, Indiana, and I have a PhD in the specialty is, my area is biological sciences and my specialty is biochemistry and molecular biology. I chose to go to graduate school. I did come in college interested in medical school, but I did a summer research program and I found that that's not where I would fit. And so I found some other opportunities and I got involved in research, and actually I was more involved in chemistry. I did organic synthesis while I was in college. And then I went on to grad school, and after grad school I did a 1-year postdoctoral fellowship in T lymphocyte signaling and at Purdue, and then after that I did another postdoctoral research fellowship at the University of Arkansas for Medical Sciences, which brought me back to Arkansas, and that was in ocular virology. So I am.
And that was what was that?
In ocular virology.
What's ocular virology? Can you give it to me more in layman's terms?
I'm getting ready to now.
All right, good.
Ocular virology is a fancy way for saying I study virus infection in the eye. So my area is infectious diseases. In fact, in particular, herpes viruses. And so I looked at how herpes viruses cause blindness in the eye. And so I could talk to you some other time a little bit more about that. And after I did the postdoctoral fellowship, I became an instructor at UAMS, and then I became an assistant professor. And then I decided there was something else I wanted to do, because working there at UAMS, I didn't see many people that looked like me in medical school. And so I wanted to come back and give back to UAPB and kind of help students along the way and help them learn some things that I learned along the way. And so that's how I came back to Pine Bluff. So I kind of had a career of change, if you will, because I came out of research and I went into strictly academia with teaching.
Yes, please.
Good evening. My pleasure to be here once again. You might have heard my story already. I was born and raised in Pine Bluff to parents who were very interested in education. My father was a family physician here in Pine Bluff, coming from Stamps, Arkansas, graduating from UAPB, where he went to school one semester and worked the next, taking 7 years to finish here. Went to Meharry and finished, and I was blessed at the time that I applied to have two brothers at Meharry, one in the medical school and one in dental school, and Dr. Kane's brother, who's my first cousin, was in dental school. So I had a lot of role models. However, I'm told that at the age of 5 by a neighbor that I said I was going to be a doctor, so I don't remember that. So it's always been my lifelong passion. And this year I finished 40 years, I graduated 40 years ago from Meharry Medical College and attended my 40th year celebration. Can't quite believe it. And I'm still loving my profession every day. Nana Isha is working with me, and we just working like a dog. I'm just thankful she's there to help me. But it's still enjoyable, and I'm still learning something every day. It wasn't easy coming through. I went to Howard University, where I got busy partying when I first got there. It took 5 years, almost flunked out. Father quit sending me money for tuition because I was messing up. And finished and didn't know what I was gonna do because I was sort of lost. I had been told by all my advisors I would never be a doctor, and they just broke out and started laughing. And took 2 remedial courses. I'm gonna tell you everything. I almost cried, but it was the best thing that ever happened to me. When I took the remedial English and remedial reading, they all told me I didn't need to be in there, but it helped me tremendously. And it helped me to learn how to take tests very well. And I got so good that they would separate me from the other students during the testing. So the tears of sorrow turned into tears of joy, I guess you might say. Nevertheless, fast forward, I came to UAPB and taught lab, the other best thing that ever happened to my academic career. And the first time I took the MCAT, I made average scores for a black. I'll just say it like it is. They were average, but I had a bad transcript from Howard. And so after teaching here for 1 year, I retook the MCAT after the urgings of my brothers, because I had sort of given up. And I went up 50 to 100% on almost every section of the MCAT. As a result of that, I was accepted to 3 schools that I didn't apply to. But once I got my letter from Meharry, I was done. That's it. I tore up everything else and went to Meharry. And I never looked back after my first 6 weeks. And so it was a rough road, but I made it and I persevered, and it's what I wanted, and I kept after it till I got it. So that's what I want you all to hear. If you really want it, you got to go for it.
So my first 2 questions, okay, one for just a mere $5, really simple. Can anyone guess what specialty I'm in? $5, yes. Yes, well, $5. Someone looked me up before they saw me come. Now, this is a much more tougher question. Okay, so for $20, okay, how long did it take me to become an infectious disease specialist at an academic center, starting with how many years of college, medical school, and my training? I got two hands in the back. The lady first and the gentleman second.
I'm going to guess 8 years.
8 years, no. The gentleman next in the back. He's smiling, so he doesn't have an answer. Okay, the lady in the red shirt. Yes, you in the back.
See,
6, no. The lady in the blue, yes, you. How many, 10 years? No, I gotta go to the other side now. Lady in the front, 15, no. Gentleman in the back with the, yes. No. Lady in the white, 13, all right. 29. So 13 years. And it took me, so actually it took me less than 13 years, but technically it would take 13 years. So it's 4 years of college, 4 years of med school. I did an internal medicine residency, which is 3 years, and then I specialized in infectious diseases for 2 years, and so that's a total of 13 years. But now, so it took me 13 years, including college, to become an infectious disease specialist. How many years of that 13 years when I started making money, that they were paying me, even though I was doing my training? How many years when I started, after I started making money? The lady, yes, in the light jacket. 8 years, all right. That'll be a $10 one. 8 years, all right, fantastic. So, do we have any questions yet from anybody in the audience? Anyone have any questions? None so far? Okay, all right. So, Nana, let me ask you this question. So, knowing what you learned in college, tell me, was med school as easy as college, or a little bit harder, or twice as hard? Give me a flavor. Where did you say you went to college? And by the way, we have one other student that's going to be joining us. He had another engagement, Mr. Christopher Stack, and he's, Stacks, I'm sorry. And so he should be here shortly too. But go on. So, where did you go to?
I went to Xavier University of Louisiana, which is in New Orleans. It's another HBCU, and it's a Catholic institution as well. I'll start off by saying, although Xavier has a reputation of being #1 in putting African Americans into med school for many, many years, and I received a great education, I don't think anything could have really prepared me for the rigors and shock of med school. It is by far the most difficult and challenging thing I've ever done in my life. Everything and anything I think I've pretty much faced leading up to this moment doesn't compare, I would say. But I will say that it's something that I've gotten used to. It's something that I love, even in my states of misery and sheer misery, because I've had many breakdowns. I would say that even in my deepest, darkest moments, I knew I wouldn't want to be anywhere else. And I loved what I was learning. I will say med school is like a fire hose in that the information isn't necessarily hard, but they hit you with so much at one time you don't know what to do with yourself. Sometimes I spread out my notes and they come from this table to that table. And I know that, I'd have to get through all the information to at least, and look at it 2 or 3 times to at least pass the test. I'm not even talking about ace the test, but just pass. And so, I think it's something that you guys should know going in. If you're thinking about med school, my advice would be make sure you know that's exactly what you want to do, and know that you're willing to put in the time and effort and energy, because once you get there, all you pretty much will be doing is med school. Not to say that you won't have a life outside of it, but it's pretty demanding, but rewarding at the same time. because now that I'm in my 3rd and 4th year going through my clinicals, I love what I do. I'm excited to go to work. I came across something a little unusual in one of our physical exams today with Dr. Flowers, and I was like, ooh, I can't believe that I actually picked that up. You know, they tell you how to do it, but once you actually get it on your own, it's kind of rewarding. It's more than kind of rewarding. It's pretty amazing. So I hope I answered your question.
Okay. So, Doctor, so tell me, of the students that were in your class with you, how many of them are already familiar with the subject work versus you were learning it new in grad school?
Oh, I think our class was about maybe 15 or 20. So in grad school, your class is probably a little smaller. Now, granted, I did go to a large university. Purdue is a large university. Many of you heard of
So
it.
Purdue is, just because I'm from Indiana, I have to tell you about it. So Purdue has over 40,000 students. It's one of the largest public schools in the country, and they have a lot of international students, and so it's really noted for its sciences and engineering.
Right. Yes, it is. And so in our department, our class was pretty small, and I can honestly say that as far as me being prepared for what the other students were, I was probably midway. I took biochemistry here. I'll use it as an example. And I love biochemistry, and I tell you that that's my area of specialization is biochemistry. I took biochemistry here. That was part of the requirement, as many of you know. I went to grad school. I took that. I had the same textbook. I took biochemistry again because that was a course that I needed to take for my exams. It was like I had never seen it before.
Whoa.
And I was like, it's the same textbook, but how come I can't get it? And so that's how, I mean, we had a lot of late night studying. We just formed different groups, and there were other people in school with us, or in our class with us, that were in other disciplines. And I do want to say that one of the things about Purdue, I didn't have to take one class. That was the beauty of it. I didn't have to take a class. I chose to take classes because I knew what I needed to do in the end, and I needed to be prepared for that. So I would say maybe midway with the rest of my class, but we all kind of worked together, and then we branched off into our areas of specialty. But also the nice thing about Purdue, they were concerned about, and they cared about if students graduated. So they have a really good retention rate with their graduate programs, and they have several. And so all of those that I met while I was there, we pretty much all keep in touch. And so, I mean, we get, one of my lab mates, she sends my kids Christmas cards still to this day. This year she sent them Amazon gift cards. I mean, that's just how close the bond gets to be, because these are people that you're down in the trenches with daily. So I would say that it was a good experience overall, but it was definitely tough.
So, Dr. Flowers, we'll get you to
Yes.
So if you could tell us, based on, give us a little bit about your experiences since you came out of medical school and any challenges you might have faced.
Well, since Dr. stepped in, it reminds me of a conversation we had the other night during an event which we both attended. And I told him when I first came to Pine Bluff, I would get a lot of patients, and they would come in with bags full of medicine. They wouldn't know what disease they had. If they had diabetes, they would say, oh, I have a little touch of sugar. They didn't know they had hypertension, heart failure, or whatever. They wouldn't, a lot of times, know the name of their doctor, the other doctors they went to. And the big thing is, they had not ever had an examination where they had to become fully undressed. So my thing was, I like to check everybody head to toe on the first visit, certainly by the second, so that I know everything about everybody that comes through my office. And so I would ask people, get everything off, take everything off head to toe. And they would say, oh, everything? What you gonna do to me? And people would verbally attack me, and they acted like I was about to commit a crime. men and women both treated me like I was about to rape them or something. It was horrible. But at the end of every exam, they were all smiling. And you know what they said? Nobody has ever done that to me before. So over the course of 30 plus years here in Pine Bluff, I have gone from, you're not gonna do that to me, nobody's ever done it, what's wrong with you, to sliding up to me now and asking me, when you gonna order my mammogram? As I used to beg people to have one, they would complain it hurt them. I'm not gonna get a mammogram. It hurts. So now they're asking me, when am I gonna have one? When am I gonna have my pap smear, Dr. Flowers? What about my lab work? You didn't tell me what it showed, and these are people that can't read and write for the most part. I tell you, when I stop to reflect on it, I start crying, because to go from trying to convince somebody that they had diabetes, hypertension, trying to convince somebody that they needed a physical exam, all the way over to challenging me to make sure I do the test and to make sure I give them the results. It's like being in heaven, and it makes me love my job even more every day. And I also told Chris the other day, if you're working in the indigent community like we are, you cannot just practice medicine and go home.
Indigent, so we may have some high school students out here.
I'm sorry.
What is that?
Well, let's see, people who are poor, or better than that, people from a lower socioeconomic status, poorly educated people for the most part. Okay, when you work with people like that, you cannot just see somebody in your office, talk to them a little bit, write a prescription and send them out. You have to do a lot of education. And I have proven right in my office, I don't have any numbers, and I'm gonna do that when I get a chance. But I just look at my practice and see that education pays, even for people who cannot read and write. And so if you're gonna work truthfully with people in need, then you have to do a little bit more, okay? You gotta go beyond. And if I were not interested in what happened to our community, I would not be sitting here tonight, okay? I would be at home kicking my heels up, having a highball with, on the phone or doing something. But I don't do that because I work extra hard doing the extra stuff, because it means a lot. It means a lot to me that Chris Steps and Nana Amadou will be coming back maybe to Pine Bluff, okay? And so I'm trying to do all I can to encourage them. And so I care about the patients in this community. I was born and raised here. So yes, I care after I'm dead and gone that patients get good care in Pine Bluff. And I think they'll get better care from other people who care. And so, anyways, it was very challenging at first, very rewarding now, and I just love every minute of everything I do every day.
Thank you, Dr. Flowers. I'm going to now introduce to you Mr. Christopher Stacks. He's just going to tell you a little bit about where he's from, what his major was in college, and a little bit about what do you know now that you wish you had known before going to med school?
All right, how's everyone doing today? Well, man, she got an AKA shirt on this J15 and she ain't even crump.
Well, while you're talking, questions too, someone asked how important are the Greeks to medical school? So you can answer that question after you talk, say your little spiel.
How important are the Greeks, huh? Well, I like to think my Greek fraternity is important. It's not Kappa Alpha Psi. If you're probably thinking that. No, I'm a member of Phi Beta Sigma Fraternity Incorporated, pledged fall 2005 here on the campus of the University of Arkansas, Pine Bluff. I am a native of this great city of Pine Bluff, and I was a biology major here on the campus of UAPB. I consider myself a well-rounded student. As I just told you, I pledged, and I was very involved in student government. I served as 2006, 2007 SGA president. And I think that experience is kind of what opened me up to the leadership and the networking that you have to do as a physician, okay? when a person is hungry, right? You don't have to tell them where the kitchen is. They can smell the food, okay? So that's just how you all have to be to get into medical school, okay? No one needs to be able to grab you by the hand. No one should be saying, okay, you really should be looking for internships. Okay, you really need to be, okay, if this is what you really want to do, no one should have to point out the resources. No one should have to point out the networks. No one should have to point those things out to you, okay? Now, you all will be here one day where we are, okay? And I didn't understand it being in your shoes, but now I'm on the other side. People read body languages, okay? So when you slumped all over, when you're like this, that's not telling us you really want this, okay? I'm looking for the person who really wants this, okay? My friend will tell you our time is very short, you know, just as a medical student, and Dr. Flowers can really echo that, you know, as a physician. So, you know, we're not here to pull a leg or pull teeth, as they say, okay? So just want you all to be cognizant of that. But one thing in particular that I know now, that I didn't know then, was that, as I just told you, it was all on me. You know, I was that individual that was I was naturally smart. Whatever I touched, boom, it was an A. So I kind of leaned on that, and my work ethic wasn't what it needed to be. So getting ready to take the MCAT, my sister's a physician, so I was like, MCAT, I don't need to study for that. I passed everything. Look at me, like, I make all A's. I don't need to study for that. And of course, didn't study, and yeah, I got my MCAT score back. My MCAT score was so low that I called medical school, and I gave her my score, and she said, no, baby, I'm talking about your entire medical, I'm talking your entire MCAT. And the highest you can get in one section is a 15. All right, so they kind of let you know what I made on my first MCAT. She laughing at me. She's like, dang, you dumb. Not
So one question came up, Christopher, I don't know if you can help us with this answer, but it says, what is the score we need for an MCAT to get in? Does anyone know?
The score you need, there's no particular score, okay? The score that gets you in is the score you need. I know it's like, oh, Chris, we need more specifics, but maybe Nana can help you, but I don't think there's one particular number that you need to have, okay? Now, there's a range of numbers that you need to have, but I don't think there's one particular number that you need.
Nana?
I won't be as vague as my partner here, Chris. I'll say probably around a 2021 and above will probably be good for some schools, especially for your state schools, if you guys are from out of state. But I will say, just because we don't get that 2021 doesn't mean that you shouldn't apply. They look at a whole range of things. For med school, I think what is really important isn't necessarily the smartest person can get, what is it, 46, 42?
What's the highest MCAT score?
How was the highest? I think it's 45, right? 45. We sit in class with some of those people, and we look at them like, you're so crazy, I would never let you touch me. Because they don't have the social skills to deal with everyday life. Like, I would never send my patients to some of the people that I'm in class with, and they're the smartest people that I know. So, I would just let you know, stay involved, stay active, be a leader on your campus, take initiative, make sure your GPA is on point now, you can't let that slip too far.
How much would you say your GPA should be?
What is it? Just make sure it's on point. Maybe above a 3.5 or 3.6 for both your overall and your science GPA, I would say. The higher, the better. I would say if you're a freshman or sophomore, this is what I learned at Xavier. Put your work in, put your work in, put your work in on the front end. Make sure you get those all A's and maybe 1 B semester. Try and do that at the front end, because once you get to your junior and senior year, you'll find out you're a little bit more busy. You get into your core course loads, they might be a little bit more difficult, and it'll give you some cushion to fall back on once you go through the rest of your year. You won't have to stress and struggle and try and pick that GPA up any way that you can. So that would be my advice.
So let me just tell you what for Indiana University School of Medicine, what the expectation is for the MCATs. So our average MCATs for everybody in our medical school is around about 31. And probably the lowest that they look at for possibly letting you in, depending on if you have some extenuating circumstances, is about an MCAT of 25. And so you can sometimes be low on your first examination. They will allow you to take that MCAT examination again. but you really want to try to study as hard as you can for the MCATs. For the grade point average, you're solid if your grade point average is a 3.5 or higher if it's in the sciences. It doesn't have to be your overall grade point average, but in the sciences, you're solid with a 3.5 or higher. Does that mean if you have a lower GPA, lower than a 3.5, you can't get in? Of course, you can get in with a grade point average that's less than that. But a lot depends on what's on your resume. So what other extenuating circumstances have you done? Maybe you've done some volunteering at an indigent clinic, you know, people with low income. You've worked in the clinic, you've worked in the health department. So you may have worked in an emergency room in a hospital. So they look at those other extracurricular activities that you have to see if you're a well-rounded person. So how important is it to volunteer? You have to have something on your resume besides your classes and your grades. Because you have to know how to talk to patients, okay? And talk to people. So I want to know that you've got some skill sets that allow me to know that if you're in with a patient, that you have the ability to get that patient to speak to you and feel comfortable to you talking to you. So they look very strongly at that. Now someone asked a question, what are the main courses we need to learn other than the sciences? Anyone at the table there? Dr. Flowers?
Do you mind if I say something before you pass it on? I think it's really important, if you have interests outside of science, just to go ahead and explore them. And be happy while you're in undergrad. And you don't want to leave any stone unturned. I wouldn't necessarily say that, maybe Dr. Flowers has another opinion, but I wouldn't necessarily say there are specific courses that you can take outside of your science courses that would, I guess, benefit you any greater than what your interests are.
I totally agree. I wanted to pass this on to you. I served on the admissions committee at UAMS for 4 years. And we would have students who majored in art, history, English, maybe some other non-science courses, who would outscore in chemistry majors, who would outscore on the biology part, biology majors, okay? So you have to do a lot of reading. That's what I want to emphasize. What else should you take other than science? Because if you read a question and you can't narrow down an answer to 1 or 2 out of 4, you're already in trouble. And reading with understanding is not just calling words, not just memorizing a definition. Okay, and so you have to do a lot of reading. Remember this, reading is to the mind like exercise is to the body. And you must read, and you must read a lot of things. You need to get outside of the scientific arena and read other things, okay? So if I can say anything you need to do, just make yourself, broaden your horizon, I'll say. So take some art, take some history, but mainly take all the English you can, okay?
I'd like to add something to that as well. And as you know, I advise most of the students in the biology department, it seems like. And a lot of times you'll come in, or students will come in and they'll need a humanities course. And I'll say, well, let's look at effective thinking and logic. That's a humanities course. And then I get all the looks and the frowns and all of that. But the reason I suggest that course is because that course is good for helping you to be able to read and analyze and answer questions on those standardized tests, such as the MCAT, the GRE, the DAT, the PCAT, all of those standardized tests. That is a good course. So if you still need, especially for our freshmen and sophomores, if you still need a humanities course, think about fitting in effective thinking and logic, because it is a good course to take. And I've had some students that have taken it, and they said, I didn't see the benefit when you first told me. And yeah, I thought it was boring, but I learned something. And it's helped me to be able to go through and look at things a little differently, especially questions. And the other course I would suggest you take, because sometimes some of you run out, you have an extra, you need some more hours to fill up to get 15 credit hours or what have you. I always suggest a writing class, and that class would be advanced composition. You need to know how to write. Some of you that have had a class under me, you always want to know, why do you have us write? Because you need to be able to have subject-verb agreement, and you need to have logical, coherent sentences. That's why advanced composition is an important course to take as well. That will be under your English elective, and that's under biology. Sometimes it's under chemistry as well. And if you're interested, we're talking heavily about medical school, but I know some of you have interest in dental school, pharmacy. You're interested in respiratory therapy, physical therapy, because I know these things, nursing, because of the conversations we've had. All of this still applies to you. And especially if you're interested in dental school, I suggest you take a ceramics course in the art department. That is a good course to take. And so there are a lot of things that students don't think of that would help them in the end, and you might gripe about, but you don't realize the benefits.
So the English is really important because we're required to do patient notes on our patients. So if that grammar's not right, you have all your other specialty physicians that are looking at your notes, and you'll be laughed out of the hospital, and you'll get poor grades if you don't have the ability to write. So that's a really important feature. So when I'm doing a discharge summary, I'm dismissing you from the hospital. I've got to discharge and say what happened during that time in that hospital, and what are my recommendations for you. And so you have to be really comfortable doing that, so that's really critical. A question that came up was, when should you take the MCAT and how? Chris, talk to us.
All right. I think ideally the perfect time would be the spring semester of your junior year. The applying to medical school is a year-long process beginning June 1st. You have to apply through the MCAS, which is the American Medical Colleges Application Service. MCAS is the acronym. Ideally, you would want to have taken the MCAT by then. Now, of course, if you haven't taken it, don't think, oh my gosh, life is over, I haven't taken the MCAT yet. I would say maybe September, October would be the latest that I would recommend someone trying to take the MCAT, because you want to make sure that you're a competitive applicant and your application is complete. If your application is not complete and someone else's application is complete, guess whose application they're looking at? They're looking at the person who's complete. And the competition is just skyrocketing each year. So that's one thing that we're trying to do with the Student National Medical Association and UAMS, is make sure that our Kansans, minority students, are competitive applicants and they're getting their stuff in on time, because a lot of what keeps us out is not the test scores, it's us getting stuff in on time and not, taking initiative. So, spring semester.
And so the other question comes, please.
I just also want to add to what Chris said. A lot of times you're in your junior year, but if you need to have taken organic chemistry and physics. Because if you haven't taken those in your junior year, you don't need to take the MCAT, because you will have a hard time. So that's why our courses are laid out a certain way, in a certain sequence. So you need to have taken organic chemistry 1 and 2, and physics 1 and 2.
Talk to us, stand up and ask your question.
Okay, you said for people who want to be a dentist and stuff, want to go to dentist school, what do we have to take again?
If you want to be a dentist, what do you have to take again? Is that your question?
Okay.
The ceramics.
Okay. Oh, the ceramics course.
So it's not like you have to tell.
You'll have to tell somebody. It'll be outside of your regular core curriculum. It won't count towards your degree credit. Let's say if you're a biology major, it won't count towards your actual degree, but it's something that will help you for what you want to do beyond being in college.
Thank you.
So what are some of the financial assistance programs for medical school? I know y'all are rich, you gotta need that money, but tell us what your friends need.
Food stamps, Obamacare. Coming in, there are a wide range of scholarships and grants available. Especially if you're a minority student, they'll have a lot of grants available, a lot of endowment funds just for minority students. If you have good grades and good MCAT scores, they have money set aside for that. As you're going through medical school, if you continue to get good grades, you can get scholarship money for that. And come out very little out of pocket. But I will say the majority of students do take out loans, loans with lots of interest, and that's what we basically use to pay for our school and live on, because you cannot work and go to med school at the same time. But don't think that there isn't financial assistance available, because there is.
In some places, like at Indiana University, we award 1 to 2 students a full, complete ride for 4 years. So based on your academic numbers, based on your extracurricular activities that you do, at least 2 of our students at Indiana University is paid a full ride for all 4 years. And so, and different medical schools have different packages that they have available. But the bottom line is, more so with med school than I think with dental school, the loans are such at a low interest rate that eventually they give you time where you don't have to start paying back until a year after you started out in private practice or whatever job that you're doing. And usually the amount of money that you're paying back is not so cost prohibitive that it's going to interfere with your living expenses or habits. So they're pretty good about that. But they're only good if you get your applications in early. The folks who get their applications in late don't fare as well with getting their financial assistance.
I'd just like to add something. For the state of Arkansas, if you do decide to apply to UAMS, we do have something called the Rural Scholarship Program Initiative, in that I believe they'll pay for your tuition, books, and all of that, not your living expenses, for the 4 years that you're at UAMS, so long as you decide to stay and practice in a rural setting for 4 years after that, I believe. So for each year that they pay for your medical school, they ask you to spend 1 year in a rural setting. So that's also, cost effective as well, if that's what you're looking at.
Yes, the lady in the back, if you could ask, yes, stand up and ask your question.
Is that just for Arkansas residents, like people who live in Arkansas?
That's almost any state. So almost every state has it, that if you practice in a medically devoid shortage area, and they will wipe away your scholarship if you work in an area where there's not a lot of physicians in that area. We have pockets of Indianapolis that has that designation, and so we have a number of folks that may work in what we call our community, fairly qualified community health centers, to pay back that time for a short period of time, and it will wipe out their debt. So,
I'd like
yes.
to just emphasize, let's just say you're from not a rich home, and you don't really have any money, you finish college, you don't even know how you're going to get money to go to the medical school, let alone enroll. I want to let you know right now, there's enough money available somewhere if you search for it and get some assistance that you can go. I don't care if you don't have a dime. Do you hear me? If you want to go and you get accepted, money will be found. You might end up having a lot of loans when you finish. Some people owe $150,000 when they finish, but when you start working, depending on your field, you can get rid of those loans. The other thing is, you might end up going to an area where they're desperate for a position, and a lot of places will pay off your loans. So don't let that deter you if you feel like you don't have enough money. And if you're at the point where you don't have money to go do your application process or make your MCAT, we're trying to tie in a program with our medical group so that if you get involved in the pre-health club, we're trying to set up something where we will pay for so many MCATs to be taken a year by students, okay? So there's a lot of ways to get to where you want to go, but don't let the lack of money deter you, okay?
So the next question is, what is some advice you would give to someone interested in applying to get a master's degree in public health? I can answer that one without going to you. Okay. So it's nice if you can volunteer at some, what we call a not-for-profit organization, whether it's like the March of Dimes, the American Lung Association, the American Cancer Society, or you know, I watched on the news last night, the state health commissioner talked about there's a high rate of SIDS deaths in the state of Arkansas, and like 15 organizations, a number of them are Greek organizations, are working on trying to educate pregnant mothers about keeping their babies lying flat on the bed and not having any blankets or toys inside the crib. So if you can work on some kind of activity related to health, whether it's violence you may work on, school bullying, but work on a project that shows your interest will be very beneficial as you're applying for a master's in public health program. Now, the next question I have is, do you have a question back there, or you just stretching? Yes, you. Okay, please, sir.
I do want to let students know, if you're in your freshman or sophomore year, we do have a partnership with the Medical Center for their Master's in Public Health. You can go to school here and work on your master's degree and take one course a year. And when you're done with school, you only have to go about another year or so, depending on how many courses we line up. And we have money to pay for your GRE. We have money to pay for the application, all of that, and you can get a master's in public health. It's for freshmen and sophomores. We know you're not at the point that you would be when you're ready to graduate, but we take all that in consideration. And the good thing about it is, if you're an out-of-state student, your out-of-state fees are waived. So you're considered an in-state student, and then when you graduate, you're still considered graduate from UAPB. You're still considered an in-state student when you attend UAMS. And that will cover a lot of students getting their Master's in Public Health. It's called the 4+1 program. And you can come and talk with me at any time about it, and I will give you a card. And we have a liaison, Ms. Christine Patterson, that works with us. We worked it out with their financial aid office, our financial aid office, and our registrars. We've been doing it for a couple of years, but we'd like to give more. And UAMS has been offering a scholarship to kind of help pay some of those fees, so you don't have to pay much to do it. And it's a really good opportunity if you should choose to pursue it.
Yes, you can ask your question, huh?
Can you take some of those classes during the summer?
You sure can.
So the question was, could you take some of those, she asked, could you take some of those courses in the summer?
Yes, you can. And, the deadlines are September, they moved them up. They are now October 1 and March 1. So if you want to start in the spring or fall, it just depends on that. But we have to get all the paperwork in, and you have to have one letter of recommendation from me, because I am the campus representative. But especially if you're in your sophomore year, it's a really good thing to kind of consider, and we can talk more about it if you're interested. And we do have I know of two people that are on our faculty staff at the university that both have doctorates in public health. One of them works at the Minority Initiative Sub-Recipient Grant Office, and she happens to be my sister. And she has a master's in public health as well as a doctorate in public health. And the other is over the Minority Research Center at the Reynolds Center, and her name is Dr. Valandra German. And so they have both different backgrounds in public health, because there are so many different areas you can go in, but they can talk to you more and direct you into other areas that you may be interested in, because I learned a lot just talking to them, because I didn't know what public health was, really. I just kind of thought about they're the people that come to the scene when there's like a major disaster. So that's what we pretty much know, but public health involves everything down to the water that we drink. So if you're interested in something like that and you don't want to pursue medical school, pharmacy, dental, graduate, that type of research in graduate school, public health is another very viable field to look into, and the pay is really good too.
So yes, so you can work in a local health department where we have health educators. You can teach people about diabetes. You can teach people about violence. We have health educators that go into the schools, that go into universities. We have water inspectors. We have inspectors in food restaurants. Wow, so we have outreach workers to pregnant mothers to teach them about what they need to know in terms of how to take care of their babies. And so it's a whole different field of what you can do. Epidemiology, if you like to do investigations of outbreaks. Yes, your question. What kind of doctors do you want to be?
Very quickly, I want to go into obstetrics gynecology, which is basically working in women's health. Obstetrics, dealing with pregnant women throughout their pregnancy. Gynecology, basically women's health, anything from, I guess I don't want to get a little bit too graphic, but, birth control. We do surgery. I will spare you guys, but they do a little bit of both. They do surgery, they do clinic work. That's why I picked it. I think it gives me the best of both worlds. Because I think I get idle sometimes, and I like doing things with my hands. So I think it's very exciting. You never know what's going to come in the door. Working on labor and delivery, stat C-sections, you just get the energy rush. I just love it. So I'm excited about that. But just before Dr. Steps, future Dr. Steps tells you what he's about to do, just a little bit about the master's in public health. I would just say, get a little bit more information about that. In talking to my peers who are doing their MD and PH, it gives you a different perspective on health and gives you a different skill set and knowledge set that medical school will give you. And I think it'll help you to be not only competitive as a physician once you're done with residency and taking a job, but it gives you a knowledge base that most of your peers don't have. And I think it's really important. Just know that you have that option and kind of pursue that. And just to let you know that if you do decide to come to UAMS, you can pursue your MPH. So if you're not sure about doing it now, that's fine, but you can do it while you're receiving your MD degree. And just want to put that.
All right, I'm going to do family medicine, somewhat cradle to the grave philosophy. Going through my third-year rotations, I liked a little bit of everything except surgery. I just hated surgery, but I realized that family medicine was where I wanted to make my claim to fame. There are a lot of stigmas placed on family medicine. Oh, don't go into primary care. You don't make any money. You don't do any of this. But again, I feel like my personality. It's an educational field. It's one focused on prevention. Not just doing procedures. My colleagues like using their hands. I like to talk. Hey, how you doing? How your mama doing? This, that, and the other. So I think family medicine is a great fit for me.
Now listen, before you go, we got about 2 more questions, and I got plenty of food across the hall. So if you're leaving, head to across the hall and get that food before you go, okay? Paid a lot of money for that food. It's good food too. So last 3 questions we got, right quick. What universities would you recommend for trying to go into a graduate program of a career of sports medicine, physical therapy? Guys, I just had surgery on my knee about maybe about a month ago, okay? I have a torn lateral and medial meniscus, and I dislocated my patella. I was out there practicing with the Indianapolis Colts, and I slipped and someone tackled me, okay? But they're doing great now. You're never gonna make it to the Super Bowl. I just want you to know that now, okay? So can anyone answer that question? What universities would you recommend when trying to go into a graduate program? The thing you really need to know was sports medicine. Okay, so hey, $20. What's the name of that specialty that's sports medicine? $20. He had his hand first and then the lady second if he doesn't get it. Yes. It's what? What? Kinesiology, no. for sports medicine. What's the name for taking care of bones? There's a specialty with sports medicine. What did you say? Yes, that's right now. Orthopedic surgery, another name for sports medicine, sort of. Yeah, he said family medicine, but hey, come on, get your time. Okay. Talk about the real sports medicine folks. Okay. All right. Okay, now the other question has to do
Oh,
with.
wait, I'm sorry, I was going to ask.
Yes, please.
When you're looking at a school, and I tell students this a lot, when you're looking at, you're saying what's the best school, there are several things that you need to address. One is, what is their graduation rate? Do they have people that look like you? Have they graduated those people that look like you? No matter what you look like, but you need to know, do they graduate people that look like you, and are they a participant in that program, and are they receptive to having people with different backgrounds in their program? And so so you can't narrow that down to one, because it may not be a good fit for you, because there may be several different areas that you may want to focus in that school particular program does not. So you can't just narrow it down to like, Georgia Tech is the best school to go to for sports medicine. So you've got to do your research. That's the key in doing anything. You've got to do your research. Ask around, talk to people, and talk to a lot of the faculty and staff at your institution, or where you've done summer programs, or you've done rotations with, or shadow. Talk to them and see what they've done and what's been their experience, and then you can kind of narrow it down from there. But I wouldn't say you could just name 3 schools off the top, because you've got to look at several different criteria.
This is something I wish I would have known looking at med schools when I was making my decision. If you're going the med school route, or I guess any route, look at the school's board scores. Look to see what the passing rate is. Look to see if everybody's passing the first time they take it. That's especially important for medical students. That's something I wish I would have known, just looking at things. And then also, like you said, where you'd be a good fit at socially. I think that's really important. You need to be comfortable with your peers and where you're going to be.
And the last question that's on here, it asks, what is your annual salary? I don't know if that question was to me or to...
0.00, -0.
How about we ask how much we're in debt? I think that's a better question. How much do you?
I would have to say over $200,000.
And I'm in the same boat. But you gotta understand, coming out, you're gonna do residency, you will be making money. Once you're done with residency, you'll be making way more money than you would have ever imagined. Yes, there are interest on loans, but there are things to help. There's a program that I looked at before coming into med school, and if you serve an underserved population for at least 10 years, so it could be anywhere, it could be in a big city, it could be a small city, underserved for 10 years, and you still have loans left over by the time your 10 years are up, they will pay the rest of your loans off. So hey, there are ways to get around it. There are things that are always coming up. Don't be discouraged by the money. But I just wanted to be honest with you guys on that point.
So for people starting their residency, I know for like internal medicine, like at Indiana University, you're probably starting at a salary of about $80,000. Yeah, it's pretty high. It starts out pretty high for your starting, and this is your training. So you're training to be an OBGYN doctor, so they're paying you as you're learning your specialty. Secondly, as a faculty member and as a health officer, I won't tell you what my exact salary is, but I will tell you the range of what we make. So as a local health officer, probably the starting salary is at about $150,000. And the range will probably go to as high as $300,000. Depends on how long you've been in the position and whether you're starting out. So you can make some decent salaries if you're working for someone. It may be tougher if you have private practice, what type of patients you serve, but you should do extremely well from a financial substantial standpoint. So, I don't know if anyone else wants to offer any questions. You know, if you're a surgeon, you may make more money than a family practitioner, so a lot depends on your specialties too, in terms of what you do. It also depends on maybe whether you do procedures or not versus you don't do procedures. So it just varies so much, but it's a whole set of opportunities that are available.
I like that. You can make a very good living financially, but more so than that, it's a very fulfilling profession. I've done very well. Of course, they're cutting us now, not doing as well financially as I used to, but it's okay. I go home happy every evening. It's a very fulfilling profession, so if you really want it, you look beyond the money, okay? You won't be poor, I'll tell you that.
So I'd like to, if we have no further questions, I'd like to have you come and close. Yes, sir. And listen, we just want to thank each and every one of you. It's been fantastic tonight. We learned a lot from you as well. And so thank you for having this opportunity, letting me know. Thank you.
Let's give Dr. Kane another round of applause. If you all still realize that she says that she is in Indianapolis, so that she took time out of her schedule to come in and share with you all and help you all kind of understand a little bit about what it's like to proceed beyond your undergraduate career. I would like to invite you all, if you're not members of our pre-health club, to become members. And I have, wherever my clipboard is, on my clipboard I have a Remind 101. You see me afterwards, I'll give you the information, and we'll send out messages. We usually try to have a meeting every 2 weeks. Typically they're on Thursdays. Some students have said that it doesn't work for their schedule, so we'll try to vary it up, but it really depends on our speaker's availability, because I think our next speaker will be someone in the, well, we like to say physical therapy, but he's actually an occupational therapist. So he'll be coming to speak to us. So if you know anyone that's interested in physical therapy per se, but he's actually an occupational therapist here in practice in Whitehall. So we were going to have him come next to speak to you all. But I want to encourage you when we have our regular scheduled meetings at 4:30 during the day, that those that can come and fill out the paperwork, because again, it is a commitment that you have to make, and you have to put in the work, just like the panelists said up here. If you really want it, you'll do it. You'll do what it takes. You'll put in the hours, you'll give up a Saturday, you'll do what it takes to succeed and be successful. Thank you all for coming. Don't forget there are refreshments across the hall. Ms. Kane, did you want to say anything?
So study skills are really important. And you have to know and have those right study skills. Because like Donna says, you get tons of information. It's not that it's that hard, but you have to learn it very quickly in a short period of time. And a lot of your colleagues would have already had those courses, so they're not seeing it for the first time. They've seen it before, where you may be seeing some of these class courses, materials for the very first time. So we have study skills that take place on Saturdays. Please come and join us for some of those classes and learn some of those skills. And then lastly, I just need to get a picture of everybody. Okay. I want you looking your best now. Hold on. Anyone looking for a job in the summer, you can come to Indianapolis. And you know, hospitals have internships. They're not always paid though sometimes, but they're great learning experiences. And I hope folks are really hungry too, because we got tons of food next door. So thank you, join us. Thank you.